Hi, I'm Joe DiMatteo of the Len and Joe Ask the Pharmacist radio broadcast. Thanks for tuning in with us again today. I have an issue today and a topic I'd like to talk to you about that is common, very common, especially in our youth today. Approximately up to 70% of our youth, of young people, deal with skin problems, acne, especially in your teens, 15, 16, 17, 18. What to do about it? Many of the pharmaceutical treatments that are available today, very problematic. Antibiotics have to be used for long periods of time. That's the typical treatment in many cases, the use of oral antibiotics. A lot of side effects, fungal and yeast overgrowth, resistance of bacteria that develops. The bacteria in the skin actually develops resistances to certain classes of antibiotics and medication. Many times forcing a dermatologist to then resort to another class of medications. The same process continues to unfold. There are a number of topical agents that are prescriptive that are sometimes helpful, azelaic acids, retin A type compounds. There are some other debriding types of compounds that create a sloughing off of the tissue. And some of them are fairly effective and fairly supportive. But I don't believe they're really getting to the root of the problem. They can be helpful, but not getting to the root of the problem. Antibiotics present a whole nother set of issues with fungal and yeast overgrowth, not only intestinally in the GI tract, but even in the sinuses. That can become a problem as well. So creating a whole nother set of problems for you. Lastly, there are very powerful synthetic forms of vitamin A, Accutane medication that is used. We know that they carry significant warnings. First of all, with pregnancy, it is a teratogenic drug, meaning that it damages and can cause embryonic types of malformations, fetal malformations. We know that this medication is now associated with ongoing issues post your use of this drug, sometimes 5-10 years down the line, of ulcerative colitis, inflammatory bowel diseases. I've seen, and Len and I both have worked with patients that have had numerous liver issues, elevated triglycerides, hyperlipidemia, high cholesterol. Now, if you're a youngster, you're a teen, you don't really care about those things because right now your concern is your face. You're self-conscious, it's an issue. It's a huge problem. I get that. I understand that. But you need to understand there's a long-term set of consequences with many of these traditional approaches. So what I'm going to talk to you about is kind of breaking the myth. Breaking the myth that your only option here and your only process is to use some level or type of pharmaceutical. When I believe that in many of these cases, the literature will support me on this. It is many times associated with a poor diet. A high glycemic load diet. What does that mean? Too many processed, too much white, too much refined, too many sugars, not enough fiber, not enough nutrients in the diet. Dermatologists will tell you that theory has been debunked. If you really look at the studies that were done, they isolated and took specific types of foods. They restricted maybe chocolate, but did not restrict high glycemic index or high sugar spiking foods. The studies, unfortunately, are not valid, and I'll stand behind that. I know that will meet with disagreement amongst medical professionals. I do not believe that the studies validate that diet doesn't have anything to do with it. Actually, the reverse is true. If I can have folks eat a more wholesome diet, less white refined flours and sugars, more vegetables, more fruits, more lean proteins, reduce or eliminate dairy, very androgen producing. I don't want to get into all the technicalities of that, and I'll get to androgens and what I mean by that in a second. But dairy plays a huge role here as well. So where are we? Pharmaceuticals are potentially a dead-end street. The use of Accutane probably would be the most effective approach, no doubt, but probably has the highest level or propensity for downline issues. You do not want to deal with an inflammatory bowel disease. That is a chronic situation that you could deal with the rest of your life. Bloody stools, mucousy stools, uncontrollable bowel problems. It's a horrific problem. The use of immunosuppressive drugs, steroids, antibiotics to control this condition. Liver issues. The liver is your gateway to health. So we're over now to what can we do from a holistic, naturopathic standpoint. You know, Len and I both are board certified in clinical nutrition. We are pharmacists, and we're also naturopathic doctoral degree folks as well. So there are, I believe, more holistic options. I'll talk to you for a few minutes, first of all, about the types of nutrients. Sometimes we'll approach this not only from a dietary standpoint, the use of specific forms of zinc, specific forms. I'm not talking zinc gluconates here and zinc chlorides and zinc sulfates. Specific forms of vitamin A. We will utilize specific forms of bacteria, good bacteria for the intestinal tract, raising your amount of fiber consumption, reducing certain foods and types of foods that you would consume. In some areas this is even termed like a skin diabetes. And the reason why in some holistic circles it's termed skin diabetes because there's an association with poor insulin utilization. Insulin helps to control your blood sugars. Well, they believe there are some links that there's an interference with how insulin is utilizing or counterbalancing your sugar utilization in your skin tissues. One of the ways to combat that is to reduce the amount of white and processed, not just chocolate. I'm talking about the amount of refined types of foods that you consume. Diet, specific nutrients. Also understand why you're prone at 15, 16, 17, 18, etc. is because of high androgen production. High androgen really is it's a testosterone issue. DHEA is a precursor to testosterone. You all make it and we all need it. Male and female, young girls, young boys, there's peak production times. But the problem is not that the testosterone is the issue, but rapid conversion of testosterone, the dihydrotestosterone, can encourage occlusion or thickening of the sebum within the pores. Sebum is the oil that is produced within the glands. So if we can reduce the conversion of testosterone to dihydrotestosterone, if we can improve your diet that reduces your production of high androgen or excessive or above what's beyond relatively reasonable for your age, we can reduce the amount of conversion, we can reduce the amount of sebum occlusion, which will clog those pores. When the pore clogs, that's still not the problem. The pore that is clogged traps bacteria within the pore. That's where we have a problem. Your diet, nutrients, as well we use some topical agents, more holistic. We use some tea tree oils with niacinamides, with green tea extracts, with pantothenic acid. So we use numerous topical agents all wrapped into one that you can use on a daily basis along with the diet, along with nutrients. And that sounds like a lot. And it sounds like you'd want to say, well, I just want to go take my antibiotics. You'll be moving to other antibiotics because the one will eventually lose its effectiveness. Number two, you'll probably eventually work through most of those. Many of the topical agents, as I mentioned, may be helpful. And I'm going to support with the use of a lot of the topical agents. But lastly, sometimes your last step in the way of dealing with acne from a medical standpoint is going to be Accutane. And Accutane brings with it, as mentioned, significant issues, significant downside, and significant harm to you physically. And at 17, that may not be a concern. But I guarantee you, once you're dealing with some of these issues, it becomes a concern. Why not take as many approaches as you can from a holistic standpoint? You can reach us at lenandjoe.com, lenandjoe.com. We do a radio broadcast daily and on Saturday mornings. You can also go look at some of the information that I have here and that I've talked about even at mscompounding.com. And there's some information about hormones and so on and how they relate in this area as well. Or you can reach us via a toll-free number at 877-275-7743. Thanks.